Have you ever experienced physical symptoms so intense, yet medical professionals are unable to find a cause? This could be more than just a mysterious ailment. Welcome to a journey into understanding the intricacies of somatic symptom disorder. This disorder is a fascinating and complex subject, often misunderstood by many. It's a psychological condition where a person has physical symptoms that can't be explained by any known medical condition. Over the next few minutes, we're going to delve into the nitty-gritty of this disorder. We'll be exploring its causes, the symptoms it produces, and how it's diagnosed. We'll also shed light on the various treatment options available. Our aim? To provide a comprehensive understanding of somatic symptom disorder, dispelling myths and misconceptions along the way. So get ready to delve into the world of psychology and medicine, where the mind and body intertwine in the most intriguing ways. Dive in as we unravel the complexities of somatic symptom disorder. So what exactly is somatic symptom disorder? Let's dive right in. Somatic symptom disorder, often abbreviated as SSD, is a type of mental health condition. It's marked by an extreme focus on physical symptoms such as pain or fatigue. These symptoms cause significant emotional distress and problems functioning. What's fascinating about SSD is that the intensity of the symptoms don't necessarily align with what could be medically explained. The symptoms can be very real and often severe, but they tend to be out of proportion to any underlying medical condition. Now, you might be wondering, how common is this disorder? Well, the prevalence of somatic symptom disorder varies, but it's estimated to affect roughly 5 to 7% of the adult population. That's quite a significant number when you think about it. To help you understand better, let's consider a real-life example. Imagine a person who experiences severe, debilitating headaches. They've consulted with multiple doctors, undergone numerous tests, and yet no clear medical cause can be found. The pain they feel is very real, but it's not linked to any diagnosable medical condition. This person could potentially be suffering from somatic symptom disorder. It's important to note here that SSD isn't just all in the head. People with this disorder aren't fabricating their symptoms. Their distress is genuine, and their symptoms can significantly disrupt their daily lives. They're not just overly sensitive to minor physical discomforts. Their experience of physical symptoms is heightened, leading to considerable distress and anxiety. So, in essence, somatic symptom disorder is a complex mental health condition where the body and mind seem to be in discord. The physical symptoms experienced are real and often debilitating, but they can't be fully explained by a medical condition, leading to significant emotional distress and difficulties in functioning. Now that we understand what somatic symptom disorder is, let's delve into how it's diagnosed. Diagnosing somatic symptom disorder isn't as straightforward as you might think. This is largely due to the very nature of the disorder, which involves physical symptoms that can't be readily explained by medical conditions or substance use. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, or DSM-5-TR, outlines specific criteria to diagnose somatic symptom disorder. Let's delve into these criteria in more detail to better understand this complex disorder. Firstly, the individual must have one or more somatic symptoms that are distressing or result in significant disruption in daily life. This could range from pain to fatigue to gastrointestinal issues or any other physical symptoms. Secondly, the individual has excessive thoughts, feelings, or behaviors related to these somatic symptoms or associated health concerns. This excessive state manifests in at least one of the following 3 ways: disproportionate and persistent thoughts about the seriousness of one's symptoms, persistently high level of anxiety about health or symptoms, or excessive time and energy devoted to these symptoms or health concerns. Lastly, the somatic symptoms and related thoughts, feelings, or behaviors must be persistent, typically more than 6 months. This duration criterion is to ensure that the disorder is not transient and represents a stable behavioral pattern. It's important to note that the individual's somatic symptoms may not be continuously present across this duration. The nature of somatic symptom disorder is such that the specific symptoms may change over time, but the excessive thoughts, feelings, or behaviors remain a constant feature. Also, the diagnosis of somatic symptom disorder does not require that the somatic symptoms are not associated with a medical condition. They could indeed be associated with a known medical condition, but the individual's response to them is excessive or disproportionate. Remember, a diagnosis of somatic symptom disorder should only be made when the symptoms are sufficiently severe to cause significant distress or impairment in the individual's daily life. Though the symptoms may be puzzling, understanding the diagnostic criteria can help in identifying somatic symptom disorder. And remember, it's always best to leave the diagnosing to the professionals. What causes somatic symptom disorder and what are its symptoms? A question that warrants an insightful exploration. Somatic symptom disorder, often abbreviated as SSD, doesn't have a single identifiable cause. It's generally believed to stem from an interplay of genetic, biological, and environmental factors. Individuals with a family history of SSD or other related disorders may have a higher predisposition to develop the condition, suggesting a potential genetic link. It's also postulated that certain biological factors can contribute to SSD. For instance, alterations in the way the brain processes pain and stress may lead to an increased perception of physical symptoms. In addition, people with SSD often have a heightened sensitivity to their bodily sensations, which may be influenced by their biological makeup. Environmental factors, such as stressful life events or trauma, can also play a significant role in the onset of SSD. For instance, a person who has experienced a severe illness may become overly focused on their physical health, leading to the development of SSD. Now, let's delve into the symptoms of somatic symptom disorder. It's crucial to note that the symptoms aren't fabricated or under the individual's control. They are real and often cause significant distress. The primary symptom is a preoccupation with one or more physical complaints, which can range from mild discomfort to severe pain. These complaints may be vague or well-defined, and they often change over time. For instance, a person may initially complain of headaches, then later develop concerns about heart palpitations or stomach aches. Regardless of the specific complaint, the individual's distress is out of proportion to the seriousness of any underlying medical condition. Other common symptoms include excessive worry about potential illness, frequent medical appointments, and a persistent belief that something serious is wrong despite reassurances from medical professionals. The person may also exhibit a high level of anxiety about their health and spend a lot of time and energy focused on their symptoms and health concerns. Knowing the causes and symptoms can aid in early detection and treatment. So, if you or someone you know is experiencing these symptoms, it's essential to seek professional help. Is there a cure for somatic symptom disorder? Yes, indeed there is. Treating somatic symptom disorder, like any other psychological condition, requires a comprehensive, well-structured approach. It's important to emphasize that professional help is crucial in this process. The treatment of somatic symptom disorder primarily involves psychotherapy, specifically cognitive behavioral therapy, also known as CBT. This form of therapy helps individuals understand and change thought patterns that lead to uncomfortable feelings, problematic behaviors, and somatic symptoms. CBT aims to reduce symptoms, improve daily functioning, and better the quality of life. In addition to CBT, other therapeutic approaches may also be beneficial. These include mindfulness-based interventions, stress management techniques, and relaxation training. These non-pharmacological interventions can effectively manage stress and anxiety, which often exacerbate somatic symptoms. Medication is another aspect of treatment. However, it's not the first line of treatment and is typically reserved for cases where the symptoms are severe or when the individual also suffers from another mental health disorder, such as depression or anxiety. Importantly, the treatment plan for somatic symptom disorder is often personalized. What works for one individual may not work for another. So it's crucial that the treatment plan is tailored to the individual's specific needs, symptoms, and circumstances. Patient education is also a vital part of treatment. Understanding the nature of the disorder, its causes, and its effects can empower patients to take an active role in their recovery. It can also help reduce the stigma associated with the disorder and promote a more positive outlook. Collaborative care is another key aspect of treating somatic symptom disorder. This involves a team of healthcare professionals, such as a primary care doctor, a psychiatrist, and a psychologist, working together to provide comprehensive care. This approach ensures that all aspects of the individual's health are addressed. Finally, it's important to note that recovery from somatic symptom disorder takes time. It's not a race, it's a journey. Patience, persistence, and positivity are essential. While treating somatic symptom disorder may be challenging, it's not impossible. With the right help, understanding, and care, individuals with this disorder can lead fulfilling, healthy lives. If you found this video informative and wish to learn more about such intriguing psychological phenomena, we have something for you. Welcome to PsyEduInsights, a platform dedicated to spreading awareness and fostering understanding about the intricacies of human psychology. Our mission is simple: to make psychology accessible and engaging for all. We believe in the power of knowledge and its ability to foster empathy, break stigmas, and ultimately empower individuals. With our diverse range of content, we delve into various aspects of psychology, from mental health disorders to the latest research in cognitive sciences. We also share practical insights and strategies to help you navigate your own mental health journey. So, whether you're a psychology student, a curious mind, or someone seeking to understand yourself better, PsyEduInsights is here for you. Remember, understanding our minds is the first step towards better mental health. Thanks for watching, and don't forget to subscribe for more insightful content.